Hello friends, today let's explore the eponyms associated with osteochondritis, avascular necrosis or aseptic necrosis in orthopedics. Osgood-Schlatter syndrome is a painful knee condition that affects adolescents. Because of differential growth during the growth spurt, the extensor muscle attachment to the knee joint becomes tighter, creating a strain on the tibial tuberosity. So, with physical activities, this tendon causes inflammation over the tibial tuberosity and manifests as a pain over the tibial tuberosity. This condition usually resolves by itself with period of activity modification, stretches, and pain relief. Sinding Larsen Johansson syndrome is a juvenile adolescent osteochondrosis and traction epiphysitis affecting the inferior pole of the patella. Although it manifests as a knee pain, something like Osgood-Schlatter's disease, the site of pain is different. In Osgood-Schlatter's disease, you will have the pain over the tibial tuberosity, whereas in Sinding Larsen Johansson syndrome, you will have a pain over the inferior pole of the patella. Initial treatment consists of relieving the pain by resting for a few days and strengthening exercise with modification of activities. Van Neck disease is nothing but ischiopubic osteochondritis. It is a rare cause of pain in the pediatric pelvis. Most of the time, with just conservative management, the patient would get better in weeks or sometime in months. Here comes the well-known Perthes disease. Perthes disease is nothing but a self-limiting idiopathic avascular necrosis of the femoral head. It affects children between the age of 3 and 11 years and can cause pain, limping, and limited movement of the hip joint. Treatment of Perthes disease aims to make sure the femoral head remains as round as possible and reduced within the joint. So the treatment depends on the child age, severity, and sometimes when the deformity is severe and when the child presents late, the child may require surgery. Most children recover from Perthes disease, but it can take 2 or more years for the bone to regrow and to return to normal. Not all bow legs are rickets. Blount's disease is a lower leg condition that can either be infantile or adolescent. It results from the abnormality of the epiphyseal growth plate in the upper part of the tibia. In a children under the age of 2 years, it may be impossible to distinguish infantile Blount's disease from physiological genuvarum. But by the age of 3 years, however, the bowing will worsen and the obvious problem can often be seen in an X-ray. Management may involve bracing to surgery based on the degree and the severity of the problem. Sever's disease is a calcaneal apophysitis. It is a common cause of adolescent heel pain, particularly in young and physically active people. Treatment includes modifying the activities, and Sever's disease will resolve itself without any treatment and rarely causes any long-term complications. Kohler's disease is an idiopathic, self-limiting avascular necrosis of the navicular bone. It is rare, painful bone disorder. It is most commonly seen in children between 2 and 9 years of age. Kohler's disease affects male kids 5 times more often than female. Treatment is mostly with orthotics or occasionally cast immobilization. Surgery is not indicated in the treatment of Kohler's disease. Freiberg infraction pattern results in flattening and collapse of the head of the second metatarsophalangeal joint, leading to degenerative changes and arthritis. More common among female adolescent athletes, especially the one with long second metatarsals. Activity modification, protected weight bearing are the early treatment. Surgical procedures largely reserved for patients with stage 4 or stage 5 disease. Islin's disease is a traction apophysitis of the peroneus brevis tendon at the tuberosity of the base of the fifth metatarsal in children, and it presents with a lateral foot pain. Diagnosis is made clinically with pain over the base of fifth metatarsal with radiograph showing an enlarged apophysis with disordered ossification. Treatment is usually non-operative with activity modification, stretching, and short period of cast immobilization as a condition typically resolves over time. Coming to the upper limb, osteonecrosis of humeral head is also known as Haas disease. This is considered the second most common location for osteonecrosis, next only to the hip joint. Whenever there is an osteonecrosis of the proximal humeral head and if the patient is symptomatic with severe pain, the treatment option is usually surgical Mostly it is hemiarthroplasty or complete replacement of the shoulder joint. Perthes disease is an osteochondrosis of humeral capitulum ossification center, presenting as a lateral elbow pain. It is a rare disease found more commonly among boys under the age 10 years. It can usually be managed with conservative treatments. If not improving, then the elbow can be immobilized or splintered for a short period. Usually after a period of recovery, the patient can return to their sports. Keinbocks refers to a avascular necrosis of lunate carpal bone with a predictable pattern of lunate collapse, carpal changes, and degeneration and arthritis. This condition is most common within the dominant wrist of an young adult man, where it appears to be due to repeated loading of the lunate. MRI is the most sensitive and detects radiographically even an occult case of Keinbocks disease. Treatment of Keinbocks disease depends on the stage of the disease and its causative factor, from simple splinting to joint leveling surgeries or sometimes even wrist arthrodesis. Preiser's disease is a condition caused by avascular necrosis of scaphoid which can lead to progressive radial-sided wrist pain. Diagnosis can be made with wrist radiograph showing sclerosis and fragmentation of the proximal pole of the scaphoid but without any evidence of fracture. Treatment is NSAIDs and observation in minimally symptomatic patient. Mauclaire's disease is a rare disease and refers to osteonecrosis of metacarpal head, which usually appears between the age 13 to 18 years. This condition may lead to early closure of epiphyseal growth plate and growth disturbance of the involved finger. Thiemann's disease is a rare genetic disorder that is considered to be a form of avascular necrosis of the phalanges of hand and toes. This can involve the proximal interphalangeal joint and the distal interphalangeal joints. The clinical symptom usually appears in adolescent or puberty and may be confused with juvenile rheumatoid arthritis. The characteristic symmetrical, firm, relatively painless deformity and an X-ray finding of an epiphyseal irregularity should suggest the proper diagnosis. With growing list of conditions that might cause vertebra plana-like images, Calve disease was once originally called as a vertebra plana. Calve described this osteochondritis of central vertebral body leading to complete collapse of the vertebra, giving a shape of a plate called as vertebra plana. This collapse often involves only one vertebra and without any involvement in the intervertebral disc. The intervertebral disc space may appear wider than normal at least by 1/3 and increased density of the involved vertebra can be seen in the X-ray. Scheuermann's disease, also known as Scheuermann's kyphosis, is one of the most common type of structural kyphosis in adolescent age group. It is an idiopathic condition and has a tendency to run in families. Scheuermann's disease develops in adolescents between the age 10 to 15 years and more common among boys than girls. It can cause severe kyphosis. Based on the severity of the kyphosis, the patient may either require a brace or might need a surgery. If you have any queries with any of the discussed disease, please post it in the comment box. We will try to clarify it as a separate video. Please tell us what you think. It will help us to improve the quality of the content what we deliver. Thank you all for your attention.